In a perfect world, you have a neuro optometrist, because I would be more suspicious of um, a convergence or divergence or oculomotor issue.
And the other, to expand on that, because I had a patient, not post-concussion, but a very similar patient that I reached out to DeAnn Fitzgerald, Dr. Fitzgerald, on that very same thing. And, we use the tinted glasses a lot to try to decrease the blue tint. So first we tried glasses, but it can also be, are they on the screen because they want to be, or are they on the screen?
Yeah.
But she said it's always something to consider, that if it's returned to work and there's maybe some underlying stress, that that may be a contributing factor, but it is also what happens when you have to process a screen. And I think, Amy, I mean, you're the one that sees all the athletes. Most of the concussions we see are either from a car wreck or older adults from a fall. There's just a lot of sensitivity to screen time, scrolling in certain directions on the phone, but yet they can still have a high VOR function. I'm sure you've seen that.
Absolutely.
Okay.
That's usually more of that visual motion sensitivity. So they might need that far VOR that I talked about, just in, day out. It's not going to address the scroll issue per se, but if there's still some lingering visual motion sensitivity in that larger sense, the far VOR, having to do the optic flow as they move towards and away from the target, can be a helpful way to address that. Otherwise, you guys touched on it earlier this week about treatment strategies around visual motion sensitivity and big screens, free apps or not free apps, and YouTube videos for addressing that.